Welcome to the CanaCard Patient Management System. End-to-end technology solutions providing safe access to medicinal marijuana treatment in Canada. All registered doctors on the CanaCard Patient Management System may access the doctor's portal by entering their user ID and password to sign in. Upon logging in, the doctor will access the dashboard, which is equipped with functionality including adding and locating new and existing patients, viewing existing prescriptions and prescription history, viewing the licensed producers within the network, billing, contacting support for assistance, scheduling appointments, and reviewing patient activity updates. The doctor has the ability to customize the frequency of activity updates to hourly, daily, or monthly notifications. The CanaCard system is designed to facilitate, support, and simplify the examination process for the doctor. A convenient feature on the patient registration form allows data to be propagated before the doctor begins the patient examination. The patient may either pre-register with their general information online or with a handheld device in the waiting room before seeing the doctor. A patient photo will be uploaded by a medical administrator on site during the doctor's visit. The patient chart displays an overview of the patient profile and unique CanaCard ID number along with a snapshot of the patient's activity history. Before administering a prescription for medicinal marijuana, the doctor must first perform a complete physical examination by clicking on the chart module. The doctor has access to all the data on the patient intake form, which was conveniently entered into the system before the patient's physical examination. This includes referral letters, past prescriptions, and any other medical documents the patient wishes to include with their profile registration. All other patient prescriptions are stored in the patient chart file on the CanaCard system. This allows the doctor to monitor their patient's progress and garner feedback during treatment. The CanaCard system's examination module mimics the standard protocol for admitting a patient into emergency care in North America. During a patient's first visit to a CanaCard clinic, the doctor will initiate a patient evaluation that is similar to a standard method used in emergency care, known as SOAP notes. The CanaCard system allows the doctor to evaluate and document all the pertinent information to assess whether a patient is actually a candidate for medicinal marijuana treatment. The comprehensive examination module allows the doctor to record the patient's vital signs and overall health status during their time of visit. Once the doctor has assessed that the patient is a suitable candidate for medicinal marijuana treatment, a recommended goal plan is formulated and documented into the system to track, monitor, and support the patient's progress. The CanaCard system is equipped with an intelligently built search query which allows doctors to locate a patient's diagnostic code. In healthcare, diagnostic codes are used to identify and classify diseases, disorders, symptoms, and injuries. To conduct a diagnostic code search, the doctor simply enters the first few letters of a condition, and the system's autocomplete function does the rest. The doctor can easily select the diagnostic code from a provided list, which will automatically add the code to the patient's profile. It is possible for a patient to have more than one diagnostic code registered in their medical records concurrently, and it is mandatory for a patient to have at least one code registered and added to their CanaCard patient profile in order for a prescription to be valid. After documenting the diagnostic codes, the doctor will click Save and Continue to store the initial portion of the medical examination. A list of any and all prior examinations for the patient is conveniently displayed below the examination module. By clicking on the Exam Complete button, the doctor can move on to the next step of generating a medical marijuana prescription. The Add Prescription module will enable the doctor to educate the patient about their prescribed medication, recommend a dosage, adjust the prescription date and duration, and inform the patient about licensed producers in their area. The prescription module conveniently allows the doctor to manually add further instructions or notes pertaining to the patient's prescription, and also displays the patient's prescription history. From here, the doctor will click the Add Prescription button to complete the module. After updating the patient's prescription files, the doctor is now able to administer a temporary CanaCard. Before a temporary CanaCard is assigned to a patient, the doctor will be required to issue a marijuana for medical purposes prescription letter to the licensed provider. This is the equivalent to submitting a prescription. In addition to the letter, the doctor will also be required to complete an application for registration as a client of the licensed provider. This comprehensive licensed provider letter also verifies the doctor's approval of and prescription for medicinal marijuana treatment for the patient. Upon signing, the system will generate 3 versions of the documents, one for the doctor, the second for the patient, and the third for the licensed provider. Thanks to CanaCard's integrated system, doctors can work with licensed providers to potentially reduce the delay for the patient to receive treatment. A digital record of both documents will be stored and emailed directly to the doctor, while the printed copies are signed by the doctor and mailed to the licensed provider. Now, a temporary CanaCard will be issued to the patient immediately after the examination, while the permanent CanaCard will arrive in the mail within 7 business days. For identification purposes, a photograph of the patient will appear on both the temporary and the permanent CanaCard. However, no confidential medical information will be stored directly on the card. At this point, the patient registration is complete, and the patient is given secure access to the patient portal so they can begin purchasing their medication online.